and welcome to the Art of Being Human. We've been talking about drugs and using the DSM diagnostic codes to determine when a person is addicted, when they're tolerant, when they're abusing the drug, and so forth. It's all codified in that DSM. But today I just want to start off with something a little different. What are the genetic predisposing factors that cause a person to be addicted to begin with? And they're not all genetic. Genetics plays a really important part because, as I said last time, a lot of people become addicted on the first use of a drug because of the biochemistry. The biochemistry of their brains are sensitive enough that they change quickly. Other people don't have such a problem with it. But there are predisposing factors in terms of drug addiction, and I want to go into those predisposing factors today. So let's take a look at what we have here. What causes a person to become addicted? Well, I mentioned genetics already. There is a heredity factor. Children of alcoholics are 3 times more likely to become alcoholics than other children. And it's interesting that identical twins are more likely to become alcoholics than fraternal twins because the genetics of the identical twins are exactly, as you know, when we have an identical twin sister or brother, it's one fertilized egg that splits completely, so you have 2 eggs, but the genetics is exactly the same for both of them. So therefore you have identical twins. In a fraternal situation, fraternal twins, and I am a fraternal twin, you have 2 eggs that were fertilized at the same time, 2 separate individuals, but they're growing in the same womb at the same time, usually given birth at the same time, but they're 2 separate individuals. In an identical situation, you have 1 egg that splits completely in 2, you have 2 individuals, but they came from the same sperm and egg, so they're exactly alike. Their genetics are exactly alike, and so therefore, if one is going to become an alcoholic, the genetics of the other are so similar, it's going to be easy for the other one too as well. So identical twins have much more chance of becoming alcoholics or drug addicted. I'll expand this to drugs because I think it's about the same as what fraternal twins do. And family members, if you have a family in which there's a lot of addiction in the family, or a lot of people are drinking a lot, they may not call themselves alcoholic, but they're drinking a lot, it's wise to stay away. I can't tell you what to do, but it's wise to stay away from drugs if you have a family history of people who have addiction, because you probably have similar genetics as to your other family members. It will be easy for you to become addicted as well. So genetics plays a big part. There are other biochemical factors. Alcohol sometimes produces a substance which is very much like morphine, and it causes addiction. Morphine is a drug, and if you have a drug that produces morphine in the system, then it's much easier to get addicted. Dopamine and serotonin are substances made from alcohol metabolism. So you have your biochemistry, you have your neurotransmitters, and some of them can be actually changed by the presence of a drug, and the drug can cause a morphine a metabolism in the system. In other words, you have your neurotransmitters, and they're changed by the drug you introduce, and in the end they produce a substance which is very close to morphine. Not morphine itself, but chemically like morphine, and that means that the chances of becoming addicted are very great. There are psychological factors. Alcohol is used to self-medicate, to stop anxiety. A lot of people who are anxious, they're nervous, they're depressed, they don't want to go to a psychiatrist, they don't want to have any medication given to them, they don't want to face the problems that are causing them to be this way, and it may be a biological condition, or it may be emotional, or it may be a combination of the two. They don't want to face that. So what they do is they start to drink, or they start to use a drug. It relaxes them, they feel better, and therefore they think they can control their anxiety. This is self-medication. They are taking drugs or alcohol. Alcohol is a drug, of course, just to relax, just to get away from their symptoms. And so therefore they're self-medicating. But the problem is they're going to become addicted in the process, and they're going to end up with more than one problem. It's always wise, if you have anxiety or depression or some other mood problem that you may run into, that you go to a professional for help. They can help you dig in and find out the cause of it, but they can also prescribe medication. I know as a counselor, I could not prescribe medication. However, I work closely with psychiatrists and closely with people who could medicate. And so what I would do is I would have the person visit a psychiatrist on once or twice. They didn't have to go regularly unless their situation was that they needed to. And then the psychiatrist would prescribe the medication, and I would do the counseling. And I worked with the psychiatrist as a team. And we did that a lot. There are a lot of people that I would send to a psychiatrist just to have them evaluated to make sure I wasn't missing anything, and then to give them medication if he thought it was necessary or if she thought it was necessary. And so they would medicate, but they wouldn't see them on a regular basis except every 6 months or so for a medication check. The rest of the time the individual was seeing me for counseling, and then I would touch base with the psychiatrist and talk with them, and we would have our own conferences so that we could unify what we were doing and coordinate what we were doing, and that was important. So it is much better for you to get medical help when you need it than try to treat yourself on your own. A lot of people try to be heroes and try to treat themselves on their own, but they usually end up by getting in trouble and having more than one problem, and that you don't want to do. So it can be used to self-medicate. It also increases, if a person is using drugs, at least temporarily, and I do want to say temporarily, it increases their sense of power, well-being, and self-worth. And if they're feeling wonderful self-worth and they have a sense of power and they have a sense of well-being, it's going to be likely that they're going to want to continue with that drug, whatever it is. Now, last time I talked about my experience with Darvon Comp. I only took about 3 pills. I took 1 pill and I felt on top of the world with it. You know, this is wonderful. It was prescribed to me as a painkiller. And then I realized that I was feeling just too good on that drug to continue with it. I tried it one more time. I had the feelings of being wonderful and everything was great and I was high off the drug, but I was also very much in contact with reality. I could do whatever I needed to do. I just felt very good in doing it. It wasn't like I was drunk. It was like I was really feeling high, very good. And then I took a second pill to see if it would repeat, and it did repeat. It only lasted for 10 or 15 minutes at a stretch, and then I was back to normal, and I realized this is the way that people get addicted. They take a drug, they find that it's good, as far as they're concerned, good. It not only makes them feel well, it makes them feel superior, and in some cases makes them feel like they have good self-worth and power and all the things that they feel are lacking in their life. And so why not keep doing it to feel good? This is what they're going to tell themselves. Well, when I experienced that, I realized that that's what people do, and I wouldn't take any more. I just tossed the prescription out, and it didn't ever get any more. And so for me, just to have that experience helped me to realize how easy it really is to get hooked on drugs. It's terribly easy to get hooked on drugs. And so you don't want to do it, you know, because you end up not only, you have to have more and more of the drug to get the same effect because you get tolerant to it, but then you have the problem of drug addiction in addition to that. So it does increase on a temporary basis, but then you need more and more to get the same effect. There are personality factors that contribute to drug addiction. A lot of people who are drug addicted start off with a low self-esteem, with depression. They tend to be antisocial. So they take the drugs and it makes them feel like then they don't have those problems anymore. But those problems don't go away. If you're taking a drug to get rid of psychological problems, you still get the problem. You haven't gotten rid of it. You feel better, but that's it. And then when the feeling goes away, you've got to take more and more of the same drug to get the same feeling, and pretty soon you have a drug-addicted problem. Plus you have the original problem of your depression, feelings of low self-worth, and you keep increasing the drug to feel better and better and better. And at the same time, that drug stops its effectiveness. Now, if you're dealing with drugs on the street or getting them over the internet, some drug dealers will put some heroin or some other type of hard drug in with the pills that you think you're taking. You may think that you're taking just a painkiller and you're getting some relief of your symptoms from that, but a drug dealer may also be adding a fourth or fifth drug in there that you don't know about. They're certainly not going to tell you, and then you have an addiction to a hard drug, heroin, opium, and you don't want that either. That's terrible, and you don't know how you got addicted to it, but it's in the drugs that you were taking. So it is a dangerous thing to do. And so anyway, you need to deal with the real causative factors of your distress, not just depend upon drugs. Now, I know psychiatrists do prescribe medication so that you can get into those things. If you are trying to get into what's bothering you and trying to do like a self-analysis, it can increase your depression and your anxiety because you're doing it on your own and you don't know how to do it right. As a therapist would know how to do it right, when to push, when not to push, when to get into things, when not to get into things, because a therapist will be trained in it. They'll know how to do it right so you won't have really bad effects. And I know that many psychiatrists will give medication to calm a person down so they can look at their past. Supposing you've been abused or something horrible has happened to you, well, you have all kinds of symptoms as a result of it, but it may be so emotionally painful to look at that a psychiatrist will give you medication to calm you down, help you to feel better so you can look at it. It's not to prevent you from dealing with your issues. It's to help stabilize you so that you can deal with your issues. I know a lot of people have told me when I was counseling them, I don't want drugs because it's going to prevent me from going into the things that are wrong with me. And I would have to say that's not the case. It will help you to be more comfortable as you look at yourself, but it won't prevent you from looking at yourself. So sometimes medication is something that's really needed, and it has to be dispensed by somebody who knows what they're doing, because not all drugs are equal. Not all medications are equal, and it has to be dispensed by a person who knows what you need, what will help you the most, what dosage to give you, and then if you run into a problem with the prescription, you can go back to the doctor and they can change it. They can change the dose, they can change the medication, because it's kind of a guessing game when you take a medication, what it's going to do to you, especially a psychotropic medication that maybe you've never taken before. You're not going to know what your reactions are going to be to these medications, and so therefore you need to have a trained specialist to help you deal with it if anything should come up. It may be that you need a stronger dose. It may be that you need not so much. It may be that the dose is just right, but it takes a trained professional to deal with these things. So to try to manage your own anxiety on your own just does not help very well. You can get really in trouble with it. Now, there are sociocultural factors that have to do with drug addiction too. If the parent uses alcohol, the children are likely to do it because they see what their parents are doing. And, a child learns what they live. And if they're living in an environment where drugs are used, where alcohol is used, and it's used as a relaxant, they get to think of that as being a pretty normal thing to do. Because after all, mom and dad do it, so why can't I? It's the same with smoking. I don't smoke. I never did smoke. And there's no cigarettes in our home. My parents never smoked. We never grew up with seeing people light up cigarettes and smoke them. Now, if we had, we might have thought, well, this is normal. People do it. When you get to be a certain age, you can smoke. So therefore, we could have gotten into a smoking habit, but my parents never smoked. My parents also never drank. And you have to see, if you're a parent, what are you modeling for your child? Are you modeling no smoking, no drinking, no drug use except for medications given by a doctor? Or are you not modeling something? Are you modeling something different that your child will latch on to as being perfectly normal? Parents who scream and fight, you know, their children scream and fight. They see their parents doing it. They think it's normal. Well, it isn't normal, and they shouldn't be doing it, but the parents are modeling that kind of behavior. You live and you behave, and what you see, children are little copycats, you know, monkey see, monkey do, I used to say to some people, because they will copy what the parent is doing. So you have to model what you want your child to see, and if you don't want your child to get used to drinking, don't drink, or don't drink in their presence. Certain cultures, of course, use more alcohol and drugs than others. So drug addiction can sometimes be learned. If you look in some of the primitive societies, they use drugs and alcohol, not sophisticated drugs like we get from laboratories, or we get from opium poppies and stuff like that. They use them more in the raw, but they use drugs, and they use it in terms of it's a part of their culture, and so people are used to doing it, and children are used to seeing it. So you can have a primitive culture where everybody is on drugs. Now, what drugs do to the body in general is that they depress the central nervous system. The central nervous system is depressed. And I've talked about marijuana before. Some people feel it's a safe drug. I do not feel it's a safe drug because it does depress the nervous system, and it gets you so involved in yourself and how you're feeling about yourself that you cut off from what's outside of yourself. You become almost disengaged with what's happening around you if you're on marijuana. And if you're on enough of it, you can start having hallucinations just like you can if you're on a hard drug. So part of the results of using marijuana depend upon the amount of it that you've actually taken. But it is possible to have very severe results with marijuana. But it depresses the nervous system, so you're not fully engaged with what's happening. You're not responsive as much. I'm not saying you're not responsive at all. You can read, you can write, you can do things that normal people do. But on the other hand, you can't really fully engage, and that is a problem when it comes to driving. If you've had enough of marijuana, you can't drive safely. And I've said before about the man who thought he was floating in his car as he was driving down the street. He felt like he was floating 3 or 4 feet off the road, and he was clearly impaired. And now with the medical use of marijuana, where people are using it for medical reasons, they've already had arrests due to people who are acting in strange ways and driving in an unsafe manner because they're high. They're not drunk, but they're high off marijuana, and they can tell by what the pupils of the eyes are doing. There are other ways of testing it. A regular breathalyzer test won't work, but other things will work, and they've already had driving arrests because of the dangerous way that people have driven on marijuana. So it will depress the central nervous system, and you can go from having a tranquilizing effect where you are, just more relaxed, to sleeping. If you get enough, you can go into a coma and then you can die. I've seen charts of this in medical books where they talk about it. First you feel kind of out of it, not quite there, and then it progresses to a kind of a sleep state, drowsiness. Then you progress to sleeping, and you can't wake up. Given enough of the drug, you can go into the coma, and sometimes you die in coma. So the drug can be addictive. It can give physical dependency. It can give psychological dependency, and tolerance is a part of that. when you get dependent on a drug, you can be either physically dependent on it or emotionally dependent on it. Physically dependent means you really got to have that drug because your body requires it now that your biochemistry has changed. Emotionally dependent is just almost as severe a problem. It's not that there's so much a change in your physical symptoms, but in your physical system, but what happens is that emotionally you don't want to be without it. You are like craving it, and the craving doesn't have to do with the fact that you are physically dependent, but now you've become emotionally dependent. When you are emotionally dependent on something, that can be as severe a problem and as demanding a problem as physical dependency. Have you ever had a craving for something? Like you want a glass of orange juice, you want a piece of cheese, you know, you want something. Nothing else is going to do except what it is that you want. And that is maybe a physical dependency, but I doubt it. If it's a food item, you want it because you like it, you think about it, you start craving it, and nothing satisfies until you get it. Pregnant women, due to the change in their hormones, get so that they crave certain foods. That's not unusual. That passes as the pregnancy develops. But for a person on drugs, if you start craving a drug and you're emotionally dependent on it, you really want it just as badly as if you were physically dependent on it. So, you know, there's no such thing as a safe drug. It just doesn't exist. And we'll be getting into all of this. I'm going to close it here because we have just very little time left. But we'll continue with this next time. Please join me then.